This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today we're going to talk about when to avoid a knee scope. So a knee scope is one of the most common orthopedic procedures. Basically what they do is you stick a camera in someone's knee and a bunch of water, and you stick an instrument in, and you can do various things in there like clean up the cartilage and repair the meniscus, or reconstruct someone's ACL. It's a very common procedure. And a lot of people have had it. I've had two in my own knee, as well as doing them, I've also had them. So the question is, maybe you've been told you need one. When should you avoid it? So if you're on the younger side, and let's say that you have a meniscal tear or something like that, and it's really bothering you, or you have some big cartilage defect, then a knee scope's probably the right choice for you if you failed physical therapy or injections. So that's a decent indication to get it. When to avoid it is, like, let's say you're in your 50s, your knee's been bothering you for a long time. Maybe you've had an injection, maybe you haven't. You get an MRI, it shows a degenerative meniscus tear, which is usually, it'll read in your MRI report, it'll say posterior horn of the medial meniscus is mostly where they are. But you've got this degenerative meniscus tear you've had for a long time, and you see the surgeon and they say, yeah, we can scope it. That's maybe when you want to think twice about doing it. If you already have arthritis in your knee, it may not, I don't think it changes anything long term. It may help in the short term, but is it really worth doing it? I mean, not unless you really want to do it. So yeah, if you're in your late 50s, 60s, or you happen to have terrible arthritis in your knee, you probably can get away without doing it. It's certainly not necessary. If you're younger and you have a healthy knee with good cartilage and you have a defect in there that didn't respond to physical therapy or anything else, then it may be worth doing a knee scope. But again, only if you need it. There used to be more of a trend of scoping arthritic knees. The evidence kind of points a lot of orthopedic surgeons away from that, so we tend to do it less. And certainly if your knee is really arthritic, like you have bad arthritis, like you need a knee replacement, don't waste your time with a knee scope. But then the problem is you go to an orthopedic surgeon and the only surgeries they do are knee scopes and shoulder scopes, they're going to want to scope it. So you just need to be careful about that. But yeah, again, like younger, good cartilage in your knee and you have a focal defect, it's worth it. If you're older and arthritic and it's some sort of degenerative meniscus tear, you probably can skip it. So I hope I was able to answer your questions about when to avoid a knee scope. If you have any questions I didn't answer, feel free to leave them in the comments below and I'll do my best to respond. But just note that I can't respond to what your specific medical situation is, because that's essentially me providing medical advice, and I can't really do that in that way without somebody being a patient of mine. If you like this video, we put out new content weekly, so please like and subscribe, and thanks for watching.